I want to thank you for coming to a truly open and public town hall. So appreciate that. I was at the other town hall and I got kicked out. So my son did not have health insurance for 4 years until the ACA, when Medicaid was extended. He didn't have health insurance because he's in the service industry. And that industry pays minimum wage, and they keep their employees below a certain number of hours so that they don't have to pay health insurance. So many of the people that are on Medicaid are working, and they are the working poor. Under Trump Care, one of the major ways to make health insurance affordable is to bring back catastrophic insurance, which is basically no insurance at all, given that preventative health care is the #1 way to keep people healthy in our society. Can you explain why my son and millions of others in his situation are not deserving of affordable, decent health care that has essential benefits so that he can stay healthy and continue working? Yay!
Okay, I don't know anything about your son, but as you described him, his skills are focused in an industry that doesn't have the kind of options that you want him to have for healthcare. So I don't believe that the taxpayers here are entitled to give that to him. I believe he's got the opportunity to go earn those health benefits. The majority of Americans earn their health benefits at work. They do. Nearly 200 million people do. There's only 11 to 30 on the most generous prospects. There's under 30 million people in the individual market. We also have a lot of people that are in Medicare, and we do have Medicaid. And Medicaid was originally launched under the Great Society to take care of the most disadvantaged people, widows and orphans, people with developmental disabilities. And the federal government reimburses states about 60% of the expenses they have for there. When President Obama launched his expansion program in order to cover folks, as you described your son, who came into this category of Medicaid expansion, they said, we're going to reimburse you at 9-to-1. It provided a perverse incentive for states to grow that population. In Ohio, it's over 700,000. 24% of the people, so your son's an outlier, he's one of only 24% of the people that are able-bodied adults who work and get Medicaid dollars. So if you're an able-bodied adult who works and get Medicaid, you're in that population. 3/4 of the people that get those dollars do not work, despite being able-bodied adults. And so when we have a social safety net, people support having one broadly across the country, but when you're an able-bodied adult, they expect you to get out of it. In your son's case, he's out of it. Well, what about prescribing what benefits he shall have? If he doesn't want a catastrophic care plan, then don't buy a catastrophic care plan. If you don't want a flip phone, don't buy a flip phone.
Oh my gosh, stop doing that.
I'm sorry. Healthcare is much different than a cell phone, and I'm tired of people using cell phone analogies with healthcare.